It's time to focus on seniors with Helping Seniors TV. The television show designed to make you aware of senior issues and needs, as well as to acquaint you with the resources available to help you age in place and with dignity. Now, here's your host, Joe Steckler.
I'm Joe Steckler, and welcome to Focus on Seniors, the television arm of Helping Seniors of Brevard County. Our show is designed to provide you with information on how to develop your own aging and care plans. Our topic today is balance, falls, and ambulation. And with me in the studio is Chris Marriott, physical therapist, Rehab Director from Gentiva Home Healthcare. And Chris, welcome to the show.
Thanks as always, Joe, for having me.
I've been doing radio and television shows with you for a number of years, and I highly respect your knowledge of the subject for today. I'm well aware of the many programs that Gentiva has designed to help people understand the importance of balance and falls and the relationship of all these things, and especially with people that are recovering from falls, stroke rehabilitation, or from surgical rehabilitation.
Yep. It's become a big part of what we're experiencing with the baby boomers coming into that age. We're going to see more and more reasons to pay a closer attention to it.
Yep. I think that part of our psyche for seniors is the failure to understand the importance of vision and balance and how these relate to each other. I know, as I've undergone different stages of therapy, that when you deprive a person of the vision, if you close your eyes, your ability to maintain your balance and your footing becomes increasingly difficult.
We become more reliant, extremely reliant on our vision as we get older. Our visions pick out the horizontals and verticals, and they straighten up our world. And when we don't have our vision, or when we have a condition like macular degeneration or cataracts, we are put ourselves at a much higher risk for falls, or whenever we try to walk at nighttime or go to the bathroom without a night light. Again, without that visual input to help coordinate our balance, we are much higher risk for falls.
You mentioned cataracts.
Anything that can cloud the visual system, impair it through your vision, whether it's double vision or cataracts or macular degeneration, all those things that will affect the ability to have clear vision will affect your balance.
You don't, as you age, you don't always develop awareness of the physical factors that affect your environment, that affect you.
And aging is a very slow process, and it's not something that happens overnight, and we don't realize that as our vision decreases, we adjust what we do, and we may be at a higher risk for balance. It doesn't happen overnight for most people. Now, some people have a fall and they realize it right away, but a lot of times with changes in strength and visual conditions, we develop a slow onset of a poor balance system.
As a therapist, and especially with Gentiva Home Healthcare, it deals strictly with care in the home. You do not have facility care.
Correct. We go in people's homes and assisted living facilities, which is people's homes. It's their home that's managed by other people. Correct.
But is it more difficult to duplicate what you might find in a rehabilitation hospital as compared to the home? How do you make these things work?
Well, in the home setting, it's a whole different type of therapy where we're not just focusing 100% on the patient. We're looking at the environment that they're living in, the conditions that they walk on. Is there sufficient lighting? Are the hallways cluttered? Do they have grab bars? So we are definitely working on the conditions, whether it be balance or speech or occupational therapy. But we're also taking in how they're managing at home, because that's a big part of whether these people can age successfully in place, is the systems they've got themselves, but also what's in place in the house.
The what you're talking about is home safety.
Home safety is a big part. We see more and more people having to live at home, modifying the homes, putting in grab bars, looking at throw rugs, looking at floor conditions, whether they've got soft plush carpet or nice solid clean floors.
You know, think back, Chris, from the time that you've been a therapist and what you've seen happen in healthcare, and now with the increased cost of care, the fact that we are living longer and more people are now having to avail themselves of assisted living care and nursing home care and other more costly elements of care, that the use of home therapy and keeping people what I often refer to as lesser elements of care are going to become even more important in this health cost equation.
Absolutely. It's going to become a paramount way of managing our healthcare system. With our wonderful technology, we've been able to keep and increase the average age of our population, which is great, but it's also creating a more frailer population who's having to live at home. 7, 8, 9, 10 years ago, people could afford to sell their property and move into a convalescent home or an assisted living facility. But those days are difficult these days because the homes are worth less, and we see more people having to live in their home and try to manage themselves there. So we've got a more frailer population living in a place where it's sometimes a little more difficult to take care of themselves.
I read a recent report on Medicaid and Medicaid managed care where they talked about two factors. One of them, cost containment, and the other, the profit margins. And Tennessee is one of the leaders in long-term care provision for the people of their state. And as I read through the report, we like to use statistics, and the statistics in one case said they used the fact that this improved Medicaid managed care was letting the Tennessee system take care of 40% more of the population, when in fact they started looking at the cost containment and the profit margins, and the percentage was actually 10%.
Wow.
So when you start thinking about what forces can we bring to bear on people aging in place cost effectively, and thinking about the cost of long-term care with us aging more and human bodies wearing out and having more of a need for physical therapy, and understanding the importance of our topic today, balance, falls, and ambulation. Without programs that you have designed at Gentiva, like your understanding, you have your Safe Strides program, and you have another one where you deal with the inner ear.
Mm-hmm.
What is that system?
Well, the inner ear is the vestibular system, and that's part of the whole Safe Strides program is working on people's balance by looking at a system that's pretty well what's failing them as we get older, which is the inner ear vestibular system.
But what can you do in a home therapy setting to help seniors maintain or regain some of their sense of balance? Is that possible to do?
Absolutely. One of the biggest things which limits how much a senior will do by themselves is a fear. In order to rehabilitate an inner ear or a vestibular system, you have to put the body on the verge of falling or on the outer edges of balance. And that's not something that we encourage people to do by themselves. So as therapists, we come in there and we put them on the verge of losing their balance, or get them to use their inner ear by putting them on foam cushions or using no vision exercises to help strengthen their inner ear. Once we've got that system initiated like that, we give them home exercise programs that are safe to work on at home that maintain their inner ear's ability to balance themselves. We don't encourage anyone to do specific inner ear exercises unless they've been taught how to do them safely, because at times they can be a little scary to do and put them on the verge of falling initially.
I noticed at one point in my life I suffered a stroke, and one of the greatest challenges for me at my age was to develop the sense of balance that was necessary for me to walk even with a cane. Mm-hmm. And I really sort of discarded the idea that I'll really walk very far without a cane. And it bothers me tremendously, Chris, when I see senior citizens, I want to say, because of personal pride, will not take a cane in their hand and use it to help them balance themselves as they walk, thereby putting them at great risk for falls and all kinds of problems.
We often see that as therapists, people who feel it's better to walk terribly with no assistive device than to walk safely and normally with a cane or with a walker. My mom is living proof of that up in Canada. She refuses to use a walker despite the benefits that I know it would help with her. We just need to get the word out there that more and more it's acceptable to see people walking in the streets with four-wheeled walkers or with canes, and it's the way to keep yourself more active. In order to get yourself out of the house and not be housebound, you need to be able to shed a little bit of that pride and use that cane and use that walker and know that that's the best thing for you.
Well, if I want to develop or put my chauvinism personality on the line here, I will honestly say that I found by using my cane, I get more young people to open the door for me. And it's interesting to see the interaction of young people for older people when they see a way to help them. I find that it seems that the help comes more naturally from younger people than it does other older people. Right. Does that make sense?
Yes. Yeah, it's a bit of a social experiment for sure when you see how much people change their interaction with seniors if they've got a wheelchair or a cane or a walker that they're using, for sure.
Yep. I don't mind using it at all, and I think that I've actually talked to people and said, "Why don't you use a cane?" "Oh, I don't need a cane." And they're shuffling along, hobbling along. I watch them try to catch themselves if they take a misstep, and just the bad things that can happen from a fall. I just
they completely outweigh the good things. You know, canes can be used for relieving some pain in the arthritic patients. It can be improving someone's balance in the unbalanced patient. It can be causing people to walk a little bit further. So there's all different reasons why we use a cane or a walker. It can be a signal to people that they need to be careful when we're walking past them in a crowded mall. So there's a lot of benefits that really far outweigh the little bit of vanity that people have by not using them.
And now that you mention it, I want to echo what you just said about the use of a cane or a rollator or a walker can help alleviate pain. It can, because in my case, I have stenosis of the spine, and I have a tendency to want to bend forward to relieve the pressure on my back. But by standing up straight, I find I'm better. But if I have the cane, it sort of causes me to force myself upright, and I can walk better once I make myself realize that it takes some of the pain off.
Right. Absolutely. And there's more than just one benefit from using any kind of assistive device. And you pointed it out very well there, from back pain to knee or to hip pain, taking some of that pressure off of that area by using that cane and putting some of it through the upper extremity.
Okay, now, Gentiva is a primary skilled nursing care organization, correct?
Skilled nursing and therapy, correct.
And therapy. Chris, how many people would you say watching this show do not realize that if they're having problems with balance, walking, or simply ambulating easily, how many of them don't realize that if they talk to their doctor and tell the doctor of that problem, that the doctor can prescribe home therapy for them to help them reduce those problems?
Oh, I would guess that if you're a senior and you're above 80, that half the people, if they can think back if they're getting around the same as they were this time a year ago, then they probably don't need it. But I guess most or half those people will say that their functional mobility has gone down in the last year.
Yeah, but a lot of people don't realize that a doctor can prescribe that.
They don't realize, and even when the doctor does prescribe it, when we as a home care agency call to set up our visits, they're a little bit standoffish and kind of don't want us to come out there until we come out to their house and explain what we do and show them that we're more than just doing some jumping jacks and doing some stretches and leg lifts. We go out and do a lot of things more than they've ever thought would be possible.
The elasticity of the muscles is extremely important. I know in my home therapy session with the Gentiva therapist that the stretching exercises and the use of the belt, if you're laying flat, my wife bought an exercise table, a workout table. It's extremely difficult to get down the floor, and for many people, it's dangerous.
Right.
Dangerous to get down the floor. You can look on the internet and you can find exercise tables that fold up like a card table. They're very safe, very comfortable, and they're easy to get onto. And you can do limbering up exercises in your bedroom in the morning, and it helps you stretch your what's the hamstring muscle. That's probably one of the most important muscles to maintain as supple as you can as you get older.
I hesitate to say that stretching is probably way more important as you're a senior than strengthening to get yourself more balance and more mobility. Strengthening is going to be important, but it doesn't play nearly as big a role as the stretching will be as you get older.
For the elasticity of the muscles.
Absolutely.
We talked a little bit about the safety factor from a home therapist, but as we live in our homes, we don't realize that we have so many appliances and built-in things, our cabinets in our home, that are very accessible to us to use for exercise.
Yes, we're very creative in the home care field, turning your own little home without too much effort into a series of obstacles and activities to challenge your balance or to stretch. So there's more at home that we can use than you probably realize when we put it together to introduce rehabilitation.
Yeah, if you go to a rehab hospital or a clinic, and they put you on like a parallel bar, and you do the same thing. If you have an island in your kitchen and you have the sink on one side and the island on the other, you generally have a 3 to 5 foot space in between there. You can do a lot of these exercises very safely in your kitchen area.
Absolutely. We open up cupboard doors and give little ledges to step up and touch up to. We can't lug around parallel bars too easily in the home care field, so we've got to be creative with what most people have in their home. And there's enough there, along with a few things we bring with us, to create a really good rehab environment.
Well, I have a home therapist that comes to the house, and she has a ball that's about that big, and she has a rubber pads about that big square and about that thick, about 4 inches thick, 3 or 4 inches thick. And she has 3 pieces of foam rubber sponge that she stacks one on top of the other. And I put my cane in one hand, and I'm balancing on that cane. I'm stepping up and touching the foam rubber without kicking it over. Or she's got me lifting the ball up and down. And then she has me shut my eyes. And then I do these exercises where I turn my head left to right and look up and down with my eyes closed. I have deprived myself of my vision, and it's extremely challenging.
It's forcing your body to start using the primary balance system, which is the inner ear. So we do a lot of activities with our eyes closed or standing on that foam cushion so that you don't have any feedback from your feet. We tell our patients it's much like trying to recover from a stroke. The best way to get that hand or leg to recover after a stroke is to stop you from using the good one. So we stop you from using your vision, and that allows your inner ear to start working back again.
Yeah, you've got a system that under your it's a Safe Strides program.
Safe Strides program, yep.
Tell viewers what the Safe Strides program is, because there's another part of it. I'll try to remember what it is while you're talking about it. It's
an innovative program that looks up why seniors are falling. It used to be that, or were they weak, or was there a problem with strengthening them? Maybe they needed a cane or assistive device. And we found that the biggest reason why people were falling is they weren't challenging themselves and their inner ear to balance themselves. They became more and more sedentary, and they didn't do activities that promoted their inner ear from working. One small fall or a misstep or an almost fall caused people to be more cautious. They stopped walking on sandy beaches or on grassy surfaces, and they stopped challenging themselves by going outside and turning with their heads. They did things very safely, which is great, but it also caused the inner ear to be less stimulated, and it kind of went to sleep. It was not able to actively coordinate with their vision and their feeling in their feet to balance themselves. So these people thought they were doing the right thing by being more cautious and not moving quickly. But what it caused them to be is their inner ear was very sensitive to movements. They'd stand up real quickly or sit down and feel the dizzy sensation. And that was their inner ear not being able to handle quick movements anymore.
The therapist will put me on this piece of foam rubber, and as I'm standing on that foam rubber, the closeness of my feet have a great effect on my balance. The closer the feet are together, the greater the challenge I have in maintaining my balance. And then she'll take and push on my shoulders, pull behind me and pull or push me. And I have to react to her pressure, and not knowing which way it is, it causes me to challenge the muscles through here.
Yep, a lot of core activities. Absolutely.
The core strength.
Yeah.
And that's what I think as we get older, do these muscles in here soften, or what happens? What does therapy do to re-strengthen those core muscles, Chris?
They can do a lot of absolute core strengthening activities. They were working on writing reactions, getting you to adjust and be able to react to a change in position quickly. We can do a lot of strengthening activities. Any kind of pool activities is going to work for core strengthening. Pilates at a very lower level, even Tai Chi, which is low impact, is excellent for core strengthening and working on your balance. So any kind of senior Tai Chi balance activities that are out there all over in many community centers.
Yoga, is that good too or not? I've heard different people talk about yoga.
Yoga probably not as much for the core balancing. It's good for stretching, absolutely. So I'm not an expert on it, but from what I understand, more of the Tai Chi, more of the Pilates is more of a core strengthening, and yoga can be more of a stretching activity for seniors.
I guess what I hope seniors start to understand is that as we age, our muscles become, I want to say, less elastic.
Absolutely correct.
And it seems that if we bend over a process of time, that the muscles in our hips, the hip flexors, shorten. It makes it difficult for us to stand up.
Yep.
And as as I age myself, all these little things keep sending signals to me to say to our viewers that it's time to wake up and realize that you can do things to improve your balance, lessen your risk of falls, and improve your overall ambulation.
Absolutely. I think there's a lot we can do with not a lot of effort. It just has to be gotten out to the seniors and introduced to them and explained to them how valuable these minor activities can be.
What else do you have in your arsenal of tradecraft tricks that can help seniors, Chris? What else does Gentiva do in the home health therapy field?
Besides the physical therapy, we've got our skilled nursing, but we've got also occupational therapy. They look at people who've got debilitating conditions like rheumatoid arthritis, that how can they better function in their home, doing their bathing, dressing, laundry, cooking, cleaning. And then our speech therapists, wonderful people for not only for getting your speech back, but looking at cognitive training, people with early onset of dementia, how a caregiver can properly communicate with someone who will inevitably become more difficult to take care of. There's special ways to dealing and communication with people with onset of dementia. So there's all ways that we can help people manage and age successfully in place at home.
That's one area you mentioned the word arthritis. It didn't come up in the beginning of our show, but that's another thing that is terribly painful for older people, just arthritis and getting those joints to move. But everything we've talked about in this show, the therapy, all these things will help lessen the impact of arthritis and arthritic pain.
Yep, there's different exercises we can show people to do, or different ways that we can show people to do things easier. If it's not taking the weight off of your knees and hips, it's our occupational therapist showing ways to get dressed easier and ways to get their hands so they don't hurt when they're opening up jars or working with their ADLs. Yeah,
I have found that the medicine pill bottles, having to push on those things so hard, and I'm told that there are special bottles that you can get for seniors that don't have to go through all. Is that true?
Yep, absolutely.
Okay. Folks, I want to thank you, Chris, for talking
Anytime.
about this. There's just so much more we can talk about it, but I do want to thank you for watching, people, today's episode of Focus on Seniors. And if you have questions or comments, please call us at 321-473-7770. And for more information on senior care and resources, visit our website at helpingseniors.brevard.com. Be sure to listen to Focus on Seniors on radio station AM 1300 WMEL every Thursday morning at 9 a.m. And Chris will be there with me sometime. And look for us in your Florida Today newspaper each Thursday for our Focus on Seniors column. I'm Joe Steckler, and I thank you for joining us today for Focus on Seniors. Thank you, Chris.
Thank you very much, Joe.
It's a good show.